my channel, All Things Psych. My name is Brittany. I am a licensed clinical psychologist and an adjunct professor. If you are watching this video, then likely you are looking for additional EPPP study tips. Well, you've come to the right place. I can help you with that process. So, without any further delay, let's go right into today's video.
Category covers the eating disorders. Eating disorders are characterized by a persistent disturbance of eating or eating-related behavior that results in altered consumption or absorption of food, and that significantly impairs physical health or psychosocial functioning. So in this category, we talk about Pica, Anorexia Nervosa, Bulimia Nervosa, and binge eating disorder. So Pica is pretty straightforward and self-explanatory. It is the consumption of non-nutritive, non-food substances such as paint, clay, and insects. What we want to hone in on is that the duration of this eating behavior has to last for 1 month. So I try to remember this by thinking pick a month from Pica, pick a month. I think that's a very good way to remember that. And just another point, 2 points actually, is that the Pica has to be inappropriate for the individual's developmental level, meaning that, if the person is 8 or 9 months, we would expect young babies to pick up non-nutritive items and try to eat them. But if they're 7, that's a completely different story. And also, we want to make sure that this is not part of a culturally sanctioned practice. So, if we can rule out those 2 things, the possible diagnosis of Pica remains. We want to make sure this does not occur in the context of another mental disorder or medical condition. And finally, keep in mind that while Pica can occur at any age, that it is most common during childhood. Anorexia nervosa. Now, anorexia nervosa is the restriction of energy intake that leads to significantly low body weight for the person's age, gender, developmental trajectory, and physical health. There's also an intense fear of gaining weight or becoming fat or behavior that interferes with weight gain. C, there's a disturbance in the way the person experiences his or her body weight. Physical symptoms such as constipation, cold intolerance, abdominal pain, lethargy, bradycardia, and for women, the loss of their menstrual. We want to also keep in mind that over half of people with anorexia meet the criteria for an anxiety disorder. Even more so, we typically see that anxiety is usually preceding anorexia, especially social phobia or OCD. The reason because of this is that what they're seeing that people who have a sensitivity to serotonin or elevated levels of serotonin, that increases anxiety. Food intake contributes to the production of serotonin. Less serotonin brings down the anxiety. So it's kind of that vicious cycle that we see with that. Another point, anorexia most commonly occurs during adolescence or young adulthood. It is often associated with a stressful life event, and over 90% of people with anorexia are female. When you're thinking about what the contributing factors to anorexia are, you want to take into account biological, psychological, and environmental factors. Now, as far as psychological factors, we see that people who are perfectionists, they tend to be at risk for anorexia. And so as far as environmental factors, the research is inconsistent. But what some of the research has found is that high family conflict links to anorexia. Also, parents who are overprotective, rigid, and excessively concerned with thinness. Mothers who are depressed or domineering, and fathers who are physically or emotionally absent. Again, these findings are inconsistent, but those are some things that may come up. Treatment. The first thing you want to do is get the person to gain weight. You typically have to go the route of hospitalization in order to achieve this. You may also use contingency management, which incorporates some operant conditioning, where they receive rewards for maintaining healthy weight. Family therapy and group therapy and individual therapy are also helpful because they ensure that the initial weight gains are maintained. Specifically, when we look at individual therapy, cognitive behavioral therapy is considered the treatment of choice. Now, Gardner and their colleagues, they really paid attention to modifying the individual's dysfunctional beliefs about weight and food, and the value of being thin and the consequences of eating. There are several stages that are involved in Gardner's cognitive behavioral therapy approach. The first one being establish a positive therapeutic alliance and enhance the client's motivation, normalizing the client's eating patterns and body weight by having them monitor their calorie intake and eating behaviors and their thoughts and feelings associated with those behaviors, and using techniques to modify their eating pattern. The next thing you would do is identify, evaluate, and modify the client's belief about weight and food using Socratic questioning, the catastrophizing, and other cognitive techniques. So again, you do data collection, and then you use that information to do some more of the cognitive work. And preparing the client for termination of therapy and identifying ways to prevent relapse and things such as that. So family-based treatments have also been found to be effective for anorexia. However, there is evidence that high expressed emotions, such as with schizophrenia, they actually increase the risk of relapse. And those are the things that you want to be mindful of. Thank you for viewing another EPPP study video. Stay tuned for the next one. In the meantime, happy studying.